How are you? Good. You found our clinic okay? Great. So, okay. Looking at your paperwork here, looks like you're here for a routine eye exam. Okay. Have you noticed any changes recently in your vision? Okay. Has this been a gradual shift, or did it suddenly start, or... Okay. Would you say that this blurry, distorted vision that you're experiencing, is it at certain times? Is it something that you're always having? Okay. Any difficulty seeing at night? Are you finding yourself squinting when you're reading or watching TV? Okay. Any eye strain or irritation? Okay. And how about headaches? Okay. And where are you feeling those headaches? Okay. Okay. Do you currently wear glasses or lenses? How about for reading? Okay. And any other issues or changes that you've been experiencing? Okay. If you happen to think of anything during our exam here today, just let me know. So, okay. Trying to move things around without dropping all the papers. So, alright, put your chart over here, and we're gonna start taking a look at you, okay? I'm gonna put on some gloves because there will be some points in the exam where I will be making some physical contact with you, and I want to keep everybody nice and sanitary. Oh, and one thing I forgot to ask. Do you have a primary care physician or anyone you would like me to forward your records from today? Okay, we can do that. On your way out, you'll want to stop at the front desk and they'll give you a little medical authorization release form to sign, okay? Alright. To start, I'm just going to check your pupils and optic nerve here, okay? So, to start, just taking a look at your eyes. Just noting the symmetry, looking for any kind of redness or irritation or anything I can see off the bat, which I'm not seeing anything concerning. You do have beautiful eyes, though. So, okay. I want you to try and keep your eyes open for me, okay? Focus on my nose. I'm gonna shine my light in and out of your field of vision. So, like this. Just like that. I know it's a bright light. I'm sorry, but I need to make sure that I can have enough of a light contrast so that your pupils shrink and then redilate. So then I'm going to be examining the mobility of your eyes, okay? So I'd like you to keep your head completely still, only looking with your eyes. See my light up here? I just want you to follow it just using your eyes. Yep, just like that. And I know I'm making some intense eye contact here, but if there are any areas where we have a limited range of motion, I don't want to miss anything. So good. You can relax for just a moment. So, put you right here. Alright, so now I'm going to do one more test with my light here, and then we'll be done with that part, okay? So I want you to tell me if my light is brighter there, or if my light is brighter there. Okay, how about here or here? Okay, how about here? Here. And peripheral now. Brighter here or brighter here? Okay. So then again, focus on my nose, okay? So I want you to tell me, while looking at my nose, how many fingers? Okay. Good. Good. Okay. 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 Excellent. All right. Okay. So the next thing I'm going to do is palpate around the external area of your eyes, looking for any kind of difference in symmetry, any sign of inflammation, any abnormal changes of the bone that might affect your eye alignment, okay? If any areas that I touch cause any discomfort or pain, please let me know. Okay? Okay. Is it okay if I touch you? Thank you. Okay. I'm not seeing or feeling anything abnormal. Could I have you close your eyes for a moment? Thank you. Okay, you can open. Everything looks good here. Okay. I'm not feeling anything that we need to be concerned about. So So, really quickly, what I'm going to do is lower the lights just a bit. So, it's a bit darker now. And what I'm going to do is place these trial lens frames over your eyes, okay? So, going to just tuck this like so. And just want to make sure that these are sitting equally, and looks good. Are they comfortable for you? Okay. So, I'm going to start with our convex lenses. Put that over. Okay. This is measuring hypermetropia or farsightedness. Okay. So, start with that lens like so. This here is a retinoscope. And what I'm gonna do is first just sort of lining it up. It's a bit bright. Okay. I'm just making sure I'm able to see your pupil. And that the line in my retinoscope fits equally in both directions. remove that lens. Replace it with a lens that's a bit higher power, okay? Okay. And those frames still feel comfortable for you? Okay. So again, lining it up. We're gonna do it with our next set here. Oh, come on. There we go. Alright. So now, make sure we're aligned. Good. I want you to look right over my shoulder at that eyeball, okay? Just look right over my shoulder. Good. Okay. And take this out for a moment. Give your eyes a bit of a rest. And when we do that, I'm going to use one of my cards here. Okay, so on my retinoscope here, you'll see that there are some words listed, okay? So, for example, can you read that for me? Beautiful. And how about that one? Okay, so I'm going to place our lens back in, okay? Like so. So now, while I'm looking, I want you to read for me the words that you can see on the card. Okay, keep going. Okay. No, that's okay. I'm just taking a look right now. Okay. Take that off. Oh, this one doesn't want to come. Come on. There you go. Okay. Let me adjust that slightly. That better? time, I just want you to read the words on this side for me, okay? So, yep, go ahead. Sorry, it's just orienting. Okay. Now we're gonna do one more. Okay. And then we're going to switch to our concave lenses. So, alright. Let's use a different card. So, okay. This one you'll see has different objects. Okay. Can you, starting at the top, can you identify what you see? Okay. And then moving clockwise. Okay. Alright, good. Okay. So we're going to go ahead and take another break, okay? I'll remove this. Now we're going to go through concave lenses here. Actually, let's use these ones. So, I'm going to place that first one in. Just going to start just by orienting here. Okay, so now I want you to look over my shoulder, right at that eyeball again, okay? Beautiful, thank you. Okay. going to look at our text card again, alright? So, I want you to tell me what words can you read on the right side of the card? Okay. How about the left? Right. Okay. Okay. So this one looks a little bit out of alignment anyway. This one has some smaller words on it, okay? I want you to do your best and read as many as you can for me, okay? So, good. Okay. Okay. All right. I'm gonna try one more lens here. Right. So, all right. This time I just want you to look right over my shoulder, right at that eye again. Okay. All right. Go ahead and remove this lens here. Okay. And I'm gonna go ahead and turn our lights back up. Go ahead and oops, sorry. Okay. So it does appear that you have a slight astigmatism. which, just a moment, I need to take a note. Which is the cause of the vision distortion that you're experiencing, especially at night. What that means is that there is an irregular curvature of your eye, okay? Your cornea is not curved the same way as a normal eye. So, it is not necessarily a strong enough astigmatism, strong enough diopter that I would recommend something invasive such as surgery or a physical correction, but we could prescribe you some lenses to try and see if that helps improve your quality of life, your comfort, and reduces some of that eye strain and headache. So the next thing I'd like to do is measure the curvature of your cornea, okay, using a keratometer, and ours is actually quite small. So, just set this to neutral, okay? It's not going to touch you or anything like that. It is just letting me take a nice and close-up look. So, what I'm going to do is get close to you, and I'm going to be looking at your eye. Through my lens here. And while I do that, I'm going to be just slightly placing my light so I can see how the light is bouncing off the retina. And this was going to take pictures for me. Let me hook this up and take a look here, okay? Right. So we have what we need there. So now what I'm going to do, is take a few measurements here, okay? Just keep your eyes open. If you can just keep your face neutral, that will help a lot. So to start, my pupil gauge here, okay? So it's just right here at the top. I want you to try to keep your eyes open for me. Okay. And then real quick, I'm just going to line this up here. We just do some preemptive measurements here, so that way I'm able to forward them to our optician and they can start preparing some frames for you should you decide that you would like to try and go forward with corrective lenses, okay? Yeah, we like to try and get everything taken care of for you, so that way there's as little legwork left for you to do as possible. Try and make it a little less stressful. Then a little more testing that I'd like to do with you before we call it a day, okay? This is a series of plates called Ishihara, and it helps us determine if there's any existing color deficiency, okay? So on these two plates there are numbers. Can you tell me what numbers you see, if any? Good. Okay. How about on these two? These two? Okay. Here. Two more. This one. Okay. And that one. Great. Okay. I'm not seeing any color deficiency with Ishihara plates. I'm gonna do one more test. So, this light is red. Okay. I want you to tell me if you see it. So this red, is that the same red as here? Yeah, it's very similar. How about here? Is that the same as there? Okay. Here and here. And here. Here. All right. We'll let your eyes rest now. Okay. So, most of our patients with astigmatism, that is the level of severity as yours, opt to have corrective lenses. We generally recommend that you start with frames before trying contact lenses. There are other options. There's a procedure where we can use lenses to try and correct the curvature of your cornea. There's also refractive surgeries that we can do, though not recommended necessarily in your case unless it gets exacerbated later on. But right now I would advise against it, and I think the best course of action is to start with corrective lenses, okay? We do have an optician that can help you try on different frames and decide what works best for you, and I will forward my measurements to their clinic so that way everything is ready and prepared for you when you walk in the door. Yeah. They'll know exactly what prescription strength, everything. Okay? Do you have any questions for me? Well, if you happen to think of anything, please feel free to give me a call. You are always welcome to do so. And in the meantime, do you think that you would like to go the route of lenses, or? Okay. Well then, our front desk can direct you there, okay, on your way out. And don't forget to also sign that authorization release for your medical records as well, okay? And I will go get these sent over. Okay. It was really nice to meet you. You take care.